Lady Gaga is a great actress, singer, musician, and performance artist. Today we're going to explore whether or not she's undergone any cosmetic procedures that may have enhanced or changed her appearance during the past decade. Here we see Lady Gaga as a middle schooler, and I want to bring your attention to her left upper eyelid, which looks different from her right upper eyelid. And we're going to see how she addresses this asymmetry. Now, none of us have symmetric mirror images on both sides of our face, but we attribute beauty to symmetry in the face. So we're going to see how she addresses this particular issue. Here we see Lady Gaga in 2004. She's 18 years of age, and we see the asymmetry of the left upper lid compared to the right. But I also want to bring your attention to her nose because there's poor highlights at the nasal tip. There's a little bit of fullness there, and we're going to see if that changes with time. The other thing I want to point out is the angle of her lower eyelids, because with time that's going to change, and right now it looks like nothing has been done to her lower eyelids, but things are going to change with time. In 2007 we see this image of her with her chin slightly down, but you can see the dorsum of her nose. It looks a little wide. Some of that is due to makeup actually making it look wider than more narrow, but we're going to take a look to see how that changes with time. In 2010, Gaga is in full Gaga mode. And you can see that she's starting to look different. She's experimenting with her looks, but what I see is a structural change of her nose. Her nose looks different. It looks more narrow. There's more highlights at the nasal tip, and it is much different than she had only 3 years prior to this photograph. And so it looks like she's probably undergone a rhinoplasty to narrow the nose and change the nasal tip with possible nasal tip grafts. In addition, her lips look fuller, and she's probably using some fillers to fill in and augment her lips. So 1 year later, she looks markedly different than she did last year, and we can see that the angles of her lateral eyelids are now upturned, and it's possible at this point either she had a surgical procedure called a lateral canthoplasty, which elevates the corners of the eyes, or she had what is called PDO threads, which are these barbed threads that are put under the skin to lift and change the face and tighten the face. But it's generally a very temporary procedure that has, I believe, significant risk associated with it. I don't like it because it's very temporary, and I don't think it's worth the risks of performing that particular procedure. That's my opinion. Other people obviously think differently. In addition, she has a drooped left upper eyelid here, and that kind of goes with what she had previously. That left upper eyelid looked different right from the start. So now it's a little more accentuated than it was in her earlier years. So 1 year later, she's gone from what I call the alien look to the Italian princess look. The contours of her lower lids are no longer elevated and angulated. They've reverted back to the way she was originally. Presumably, the PDO threads have worn off or they've been removed. And in addition, she's using makeup to give the camouflage appearance, to narrow the nasal bridge of her nose. In 2012, Lady Gaga is mimicking Gina Lollobrigida, who was a famous Italian actress in the 50s, and she continues to experiment and kind of playfully imitate her icons. If you're finding this entertaining, please subscribe to my channel and keep watching. In 2015, we see a number of changes that have occurred. If I can draw your attention to her left upper eyelid, it looks more droopy than it has from the past. And I think she has an ongoing ptosis of the left upper lid, which means that the internal structures of the eyelid are slipping, and her eyelid is dropping down. The aperture of her eyelid is getting more narrow, and it can interfere with someone's visual field, and it does need correction at some point. In addition, she has a fullness of her lips that I haven't seen previously, and I think that she's had some lip augmentation, probably with Restylane or Juvederm or some other hyaluronic acid gel fillers to fill the lip. And I say that it's probable because she has a lot of variation in terms of the augmentation of her lip. And she has filling along the vermilion border. You can see how well-defined the vermilion border of her upper lip is. In addition, she also has hollowing of her cheeks, and some that I haven't seen previously. And that hollowing, she's kind of used makeup in the past to create this image of hollowing here, but now I actually think there was a structural change, and that may be due to some buccal fat removal. And what is that? That is actually taking fat from the inside of your cheek and removing a small quantity of fat from each of the buccal fat deposits in her cheek. And of course, that can give a more contoured look to the face. However, with time, some people do not look better. They actually look older. Okay, so you have to approach those procedures with a lot of caution. So here we see her in 2016, and we can see the apertures of her eyelids are actually symmetric at this point. And the left upper eyelid apparently has been raised upward with a ptosis repair, surgical repair, and now there's symmetry between the left and right upper lids, except for the left upper eyelid crease is higher. And she has also this hollowing, again, of the buccal region, which has actually looks even more indented than it did previously. So if we look at this profile of her in 2017, we can see that her chin is relatively small and is not projecting forward. It does not look like she had any chin implants of any kind. So I don't agree with other observers who think that she might have had a chin implant. In 2017, we can see that she has this Marilyn Monroe look, and again, this accentuation of the buccal fat region. It looks like she's lost weight, and she's starting to look a little older, actually, from that procedure. So 2018, she looks much different again. It looks like they've done some augmentation of the upper eyelids to fill in this hollow that was present right from her childhood on. Now they filled it in, probably either with a temporary filler like Restylane or Juvederm, and possibly with a fat graft. I'm not sure. Her lower face also looks fuller. You don't see this this hollowing in her face that you saw only a year previously. And you can see that her lips have also been augmented. And when they augmented the lips, they look a little asymmetric. They don't look symmetrically filled. So if you look at her lip, like the right upper lip looks full, her left lower lip looks fuller. They just didn't balance out the injection to make it look perfectly symmetric. In 2018, again, we see that her jawline is very sharply defined. Her neck doesn't have hardly a single line on it. In fact, her whole face has no lines on it, and it's probable that she's using Botox and fillers to fill in every last line and wrinkle. But it's possible also that she might have had some kind of minor or lower facelift. I'm not sure. It's very difficult to say. She doesn't have, on lateral view, she has no sign of any incision around her ears, which would have indicated that she had a facelift. So I'm not sure what happened here. It may just be fillers or fat grafting that might have taken place, but I'm unsure. 2019, I want to just draw your attention again to her upper eyelids where there's this fullness up here, and that again is probably due to either fat grafting or fillers that have been placed into the skin there. In 2022, I want to point out two things. One is the tissue below the eyebrow in here that has been augmented previously with filler or fat is now starting to dissipate. You're starting to see the lines and wrinkles emerge, and there's a deflation of this area here. In addition, her eyebrow peaks between the lateral limbus of the iris and the lateral canthus of the eyelid. So in this area, she has a natural curvature of her eyebrow, which is of course natural in shape. In 2023, we can see further deflation of the tissue below her eyebrows. This is starting to fan out and starting to get a little crinkled up, and that's due to the tissue volume shrinking. And there's a change in the contour of her eyebrows. They're now starting to flare out. They're no longer arching and peaking at those points I previously pointed out, which is at the lateral canthus or the lateral limbus of the eye. And there looks like an upward sweep to the lower eyelids. So again, has she gone back to PDO threads? I don't know, I'm not sure, but it looks like something is going on to change the contour of her periorbital regions. This is Lady Gaga in 2024, and you can see she looks much more conservative than she has in her previous images. And I think that it's because she's starting to emphasize her talents as an actress, and rather than her persona and her imagery as a performer. That's probably a wise thing to do because it'll sustain her for many, many decades, her acting, and whereas her imagery may change and her fan base may change, but I think that she's accomplished a tremendous amount in a short period of time. And what I've presented today is really only conjecture. I can't tell you any of what I've said is actual fact. It just looks like she's had a number of these cosmetic procedures performed in order to enhance her appearance. We've had kind of a lot of fun looking back to see how she's evolved over the last decade. If you have any further questions regarding her, please leave the comments below. I'm more than happy to respond to them. And I look forward to seeing you in my next video.